Labor and delivery, honestly, the hospital in general is like a whole other land. So what happens when you walk into labor and delivery? Today, I'm going to tell you what to expect in those first few minutes, hour that you're in labor and delivery, and kind of, the choose your own adventure that happens after that. And yes, this is coming from working at 3 different hospitals, plus having 3 kids of my own and talking to millions of pregnant people online. I'm really excited that you guys are here because it honestly is the first thing that is sort of off-putting to a lot of people. So if you know what to expect, it's really going to prepare you in such a good way. Okay, the first thing is you are going to hit the admitting desk. And that is just basically a secretary. This is not somebody that has medical training that's just going to be like, hey, why are you here? Mostly deciding if you're scheduled, which is a whole different aspect, or if you think something's wrong and you're not particularly stable, that means they're going to send you right back to labor and delivery. There's something called M-TALA. That means that we need to assess people that are in labor or think something's wrong with them or baby urgently. Now that is different than if you come in for a scheduled C-section or you come in for a scheduled induction or a scheduled procedure. That's different. Those people, they can ask you to fill out all the paperwork, get your stuff at the desk. Other people need to go directly to the room, and then usually they'll come back to the room or ask your partner to go out to get more information about how the heck they're going to bill you, because that's going to be coming up. But big pro tip, they should not be stopping you for anything other than like your name, maybe your address, so that they can get you in the computer system. It's annoying, but it's super important that we have you in the computer system so that we're able to chart and take care of you effectively. So next, you're going to go to a room. Now, in labor and delivery, there's 2 different types of room. There's a labor room and there's a triage room. There's also antepartum rooms, but those are the big ones that most people go to. So if you're in rip-roaring labor, they may just send you to a labor and delivery room. Some places, that's where they triage. If we were kind of short on staff, we would triage in our labor rooms, but we also had a separate section just for triage, depending on kind of how the day was going. Again, if you go to a triage room, sometimes it's not even a room. Sometimes it's just curtains. And so that's something to expect as well. If you're in triage, or even if you're in labor room being triaged, at that point in time, we're trying to decide what we're going to do with you. You might be coming in with just a bladder infection. So if you're in the triage room, we're going to check your urine, check any other issues, make sure that you and baby are safe. And then, a doctor could give you medication if you have a bladder infection. Or you might be coming in thinking that you're in labor, but we find out that you're only 1 centimeter and your contractions, aren't super frequent, and we might send you home. Or we find out you're in rip-roaring labor and we just send you directly to a labor and delivery room. Sometimes you do have to wait in a triage room longer than we wish. It just depends on how full the labor and delivery unit is. It really depends. Again, labor and delivery has a finite number of rooms and resources and nurses. And so sometimes you hang out in triage longer than we wish you would. Just something to be aware of. But if you're keeping me, can I get a labor room? It's fine to ask for that. It's fine to let your wishes be known. You just have to know sometimes they can't give you what they don't have. So back to it. We put you in a room. Our first thing is going to be putting monitors on, especially if you're in your 3rd trimester on. Now, pro tip here, every hospital is a little bit different about the number of weeks you should be before you go to labor and delivery. I would say the general rule is about 20 weeks on, you go to labor and delivery, pretty much whatever's going on with you, any cramping, bladder infections, anything like that. Obviously, if you're having a heart attack, go to the emergency room, or if you broke a bone, go to the emergency room, because I'm literally like zero help with that. But if you think it's anything like abdominally related, they send you to labor and delivery. Prior to that, you go to the emergency room and they take care of you. So check with your provider at your next appointment about where you should be going when you go to the hospital. Some hospitals, everybody goes straight to the ER and then they triage you into labor and delivery. But most hospitals, I think, say just go to labor and delivery. Of course, if you stop by the ER, they can help you as well. Okay, so we put the monitors on. Now, I've talked a lot about intermittent auscultation, but I will say that when you first get to the hospital, I think it's really smart to get an NST, which is the full monitors on your belly. That gives your nurse an opportunity to kind of discuss with you about what's going on instead of taking all that time to listen to baby. It's really hard to talk to you at the same time that we're doing intermittent auscultation. So most often, I recommend that patients get a full NST when they come to the hospital. It just tells us how often your contractions are, how baby's managing those contractions in a really good place. Once we get that NST, which is usually 20 to 30 minutes, then you can make the choice if you want to switch to intermittent auscultation or if you want to keep using the monitors. Or some places do what's called intermittent monitoring, where you just get an NST every hour. So you can kind of discuss what's best for you at that point in time. But putting monitors on is one of our most important things to make sure that you and baby are doing well. We always had the goal everywhere that I worked to get the monitors on you within 20 minutes of you getting in the door. So most often we were really good at that, but sometimes when things are crazy, it got a little bit difficult. So that's just something to keep an eye on. As a note, in labor and delivery, we don't really have a waiting room. We might if you had a scheduled NST and we just can't bring you back yet. But if you're coming in labor, we really need to see you pretty darn quickly and get those monitors on. That's how it's different than like an emergency room where they definitely have a waiting room. After we get the monitors on, we are going to ask you 60,000,000 questions. Now, I have seen some people online offering you to like fill out those questions in advance, but as a nurse, I'm still going to ask a lot of them at the point in time, because what if, on that paper, it might say, are you having discharge? And when you filled it out, you weren't having discharge, but are you having discharge now? Like a lot of it has to be done in the moment. Now, your mom's grandma's brother having prostate cancer, that you can fill out, although I don't know that it's super important, or your surgical history, things like that. But some of them we have to ask in the moment. At that same point in time, if your provider has sent over your prenatal record or all the things that they've done in the office, we'll also be reviewing that and putting some of the prenatal record information into the hospital record. Things like your GBS status, RPR, if you've had measles before, other lab work, your blood type, things like that, we're going to be putting into the system. And caveat, even if you've come to labor and delivery before, there's a lot of those questions we have to ask again. Probably not the cancer stuff, but again, like discharge, if you feel safe in your home environment, that's on every single assessment, every single time. So that's just something to be aware of. I have seen some people saying that their partner could not come into the room for that assessment. Now, I would always ask, is it okay if your partner hangs out in here with you during the assessment? Because I think it's just nice to have them in there with you. Of course, that question of, are you safe in your home environment? I would usually ask that when I took them to the bathroom, or I would ask it initially and just kind of get a vibe and then ask again. But, if you really want your partner in the room with you and they're trying to separate you, say, hey, it's fine if he comes back in the room. Now, if you are not feeling safe in your home environment, feel free to tell him to wait in the waiting room, because we would love to help you with that. Sometime during this long assessment, we are probably going to ask to check your cervix. In case you don't remember, your cervix is just the bottom of your uterus. So we go into your birth canal and we check to see how thin, how open, and kind of where the baby's head is in this uterus. It is a really good tool in our toolbox, especially if you think that you're in labor, to know how much labor you're in and if it is helping your cervix to actively dilate. So a cervical exam is usually part of the admission assessment, not always, but sometimes, so it's important to be aware of. I actually have a whole post on when you can refuse a cervical exam. I'm going to link it down below. During this same time frame, we are going to be doing a physical assessment. So that means we're going to be putting our stethoscope in and listening to your heart and lungs, checking, if you're swollen, things like that. We should be doing a very hands-on physical assessment. Now, I know nurses who do not do a hands-on physical assessment, but I definitely am. I want to listen to your lungs. I want to listen to your heart just to have a baseline of where we're at. I probably do a better one if we're admitting you to labor and delivery than if we're just triaging you, but they should be hands-on, checking out how you're doing. And also palpating that belly, seeing how firm the contractions are and things like that. Now, after we get all of that information, we call your provider and we say, hey, Betsy's here. She thinks she's in labor. This is what's going on. She's having contractions every 3 minutes. Her cervix is 2 centimeters. And then your provider gives me an order to if you should stay or if you should go, or if we're just going to kind of watch you for a little bit. If Betsy was 2 centimeters and contracting every 3 minutes, most often the order will be, hey, let's walk her for an hour and see if her cervix starts to open up a little bit more. Because if her cervix is not opening up more, it shows you're more in early labor, and maybe home would be the best option for you. But if we walk you and suddenly you're 4 centimeters, that shows you're in active labor. Let's get you into a room. Now, if we are keeping you, most often we do want to put in an IV. I have a whole video on the importance of IVs. It's either up or it's gonna be up, but I'll link it down in the show notes as well. Big fan of getting an IV, at least a saline lock, which if you're like, Hillary, what the heck is that? watch that video. It's going to tell you more about that. And then it's going to be just like a hurry up and wait type scenario, right? We've gotten a lot of stuff done with you, but then we have to do a lot of behind the scenes stuff, like getting you in the computer and getting all the things ordered and pulling medications and possibly checking on our other patient if we have more than one patient. So there's still a lot of waiting that can be done in the hospital. If you'd like to get off the monitor and move more around the room, this is a great time to ask your nurse, and they should give you a call bell that you can call at any time to ask them questions or see if you can do something differently. Those triage beds can be really painful in early labor. So if you want to get up and move to a different location, maybe like all fours or just on the side, like leaning over the bed, ask your nurse so that she can help the monitor stay on and we can make sure that you and baby are safe. Now, if you're loving this walk through labor and delivery, I actually have a whole class that I recommend that walks you through all of labor and delivery to tell you different choices that you can make and things to expect so that your expectations are good, but you're also ready to make choices for yourself. I'm going to link that class down below because I really think it helps you feel calm and ready for what to expect at the hospital. Now, this is what happens when you go to labor and delivery, but how do you make the choice of when to go to labor and delivery? I have a whole post on when to go to the hospital and what to be thinking about and what to talk with your doctor about, so don't miss that one. Thanks for joining us here on The Pregnancy Nurse, where we get you prepared, not scared, for your upcoming hospital birth.